Skin cancer affects millions of Americans every year, even here in the Northwest, where we get more clouds than sunshine. But early awareness and smart protection can make a huge difference. And today, Optum Care dermatologist Rachel Wheatley is here to break down the symptoms you shouldn't ignore and the everyday habits that could help lower your risk, which is very important. Thank you so much for being here, Rachel.
Thank you so much for having me. It's such an important topic. I'm happy to discuss.
Definitely. So what is skin cancer and how does it develop?
Yeah, so skin cancer is a disease caused by the cells in your skin growing too quickly or dividing too rapidly. We know that skin cancer is caused when there's damage to our skin cells that leads to a bump or a spot forming that shouldn't be there. Skin cancer is actually the most common type of cancer, and there are a few types, but the most common ones are called basal cell and squamous cell carcinoma, which are typically slow-growing types of skin cancer that can be treated effectively and almost never spread to other parts of the body. The skin cancer we worry most about is a cancer called melanoma, which can metastasize or spread to other parts of the body. But the good news is that skin cancer is often very treatable if it's detected early.
Okay, and so what causes skin cancer? I always just think out baking in the sun. Is
That's
that
right.
what it is?
That's right. You know, most skin cancers are caused by ultraviolet light, which is the invisible light that comes from the sun or from tanning beds. Actually, what happens is the UV light hits those skin cells over and over again, causing damage to the DNA, which is like the little instructions in our cells that tells our cells how to grow and divide. And when those instructions are damaged, that can lead to the cells growing in the wrong way. In fact, 9 out of 10 melanomas are caused by UV light, and tanning beds are especially dangerous.
Makes sense.
Yes, they can cause skin cancer in a lot of people, especially if you have exposure before the age of 35.
What symptoms should people be watching for?
Yeah, this is the most important one because this is something that you can do at your home. We talk about the ABCDEs of melanoma, which stand for asymmetry, irregular border, multiple colors in the same lesion, a diameter of 6 millimeters or greater, which is about the size of a pencil eraser, and then E is evolution or change over time. We also talk about looking for symptomatic lesions, moles, or spots that itch, bleed, burn, as those can sometimes be signs of skin cancer growing too.
What should someone do if they see something that doesn't seem right or looks a little abnormal? I just went and got checked actually with you all, and I'm very proud of myself
Good
too.
For you.
Yes.
That's awesome. Yeah, I always tell patients they should trust themselves and they should trust their instincts. If something looks different, if it doesn't look right, we talk about the ugly duckling sign of melanoma, so the spot that looks different than your other spots. That's a reasonable time to go see your dermatologist.
Okay, and how can people lower their risk? Because I'm sure that's also top of mind as we're getting into the warmer months for a lot of people at home.
Totally. Avoiding as much UV exposure as possible, avoiding those peak sun hours between 10 a.m. and 2 p.m., avoiding going into tanning beds, and especially avoiding sunburns in younger years. Most importantly, our kids and our teenagers getting sunburns earlier in life do increase their risk of skin cancer. Also, if you have a lot of moles, like more than 50 moles, it's probably worthwhile to go see a dermatologist.
That's me right here. And it's interesting because you look and you have some dark moles, and I was freaking out about that. But then when I went in, if it's similar, then it's actually not as big of a deal. You're looking more for that like ugly duckling.
That's right. Yeah, I always talk about, oh, your moles look like brothers and sisters of each other. They have a similar fingerprint or footprint, and that's usually reassuring.
Okay, I like that. What are the best ways to protect your skin from the sun?
Yes, so we talk about a layered approach to sun protection, and the more layers, the better. We talk about seeking shade, so that's one layer, especially on sunny days. Wearing sun protective clothing or any clothing, but sun clothing with a UPF or ultraviolet protection factor can be especially protective of the sun. Wearing a hat that protects your nose, the back of your neck, and your ears, a wide-brimmed hat. I always talk about the dorkier, the better. I do see skin cancer in people's parts, especially, so protecting your scalp is important. Sunglasses, and then sunscreen, SPF 30 or greater, applied every 2 hours when you're in the sun and immediately after swimming or sweating.
And it makes sense even here with the clouds.
That's
like
right.
To still every single day SPF you recommend in the
That's
scalp.
right.
I always forget about my scalp.
Yeah, your scalp. A hat does the job too,
True.
but there are some really nice spray sunscreens that you can do in your scalp as well.
This was very informative. Thank you so
my
much for being
pleasure.
here. And
So,
everyone
yeah.
get their skin checked.
Please do. Yeah, thanks for having me.
And for more information about Optum Care options here in Washington, head to the website that you see right there on your screen.
New Day Northwest is sponsored by Optum.